Hi, everyone, and welcome to the Heart of Innovation, where we explore groundbreaking approaches to vascular health. I'm Kym McNicholas, joined by our guest co-host, Dr. Michael Misha Ginsberg, who brings his clinical experience performing embolization procedures for hand osteoarthritis, for knees, all of the above. And we're going to be talking a lot about that today. That is today's topic. We're talking about embolization. It's a personal topic for me because in recent years, I've experienced early onset osteoarthritis in my hands, particularly my thumb, which I just found out as we were waiting for this show to begin from Dr. Kadar, that for women over 50, although I'm 2 weeks before I turn 50 at the airing of this show, he guessed it, that more than 30% of women actually have an early onset, or maybe it's not an early onset. It's just an onset of osteoarthritis in their thumb. But my father as well has been struggling with hand osteoarthritis. Like many patients, we've been searching and searching for solutions beyond conventional treatments. And that search led me to discover hand embolization, a fascinating procedure that targets abnormal blood vessels in the arthritic joints. This perfectly aligned with our show's focus on circulation innovations. And today we are honored to welcome Dr. Yuji Okuno from the Okuno Clinic in Japan, the creator of the Okuno Method, the godfather of treating osteoarthritis in the hand through embolization. We're also joined by Dr. Assaf Kadar, an orthopedic surgeon specializing in hand and upper limb conditions, and he is a pioneer of his orthopedic methods as well. So I can't wait to hear about those. Dr. Kadar leads research at the, and I may mess this up, the HULC bioengineering lab, developing new suspensionplasty hand and digit devices. Can't wait to hear about those as well. And together, all of us are going to explore both interventional and surgical approaches to hand osteoarthritis, giving you a comprehensive look at treatment options beyond the standard medications and numerous steroid injections. Dr. Ginsberg, my amazing co-host, did I do it justice at all?
Perfect. And
Oh, good.
what I can say, I would never be able to tell you're coming close to 50s, but
Thank you.
But
I appreciate that.
What used to be 50s is today 30s, right?
Exactly. 29 forever. I never thought I'd hear myself say that, but yes, I'm now 29 forever. But this osteoarthritis thing, it just reminds you that, nope, you're not 29 forever. Yep, you are going on 50 here. And beyond 50, if those folks are watching this on rerun in September. But we have an amazing, would you mind just introducing us again to our amazing guests that both you and our friend we call Dr. Oz set us up with here?
Sure. So Dr. Okuno, as you mentioned, is a widely recognized innovator behind musculoskeletal embolization, sort of a groundbreaking, minimally invasive approach to arthritis. It targets abnormal blood vessels to alleviate chronic pain.
Yeah.
For conditions like osteoarthritis affecting large joints, like the knee and the shoulder. And now, and more recently, also targeting smaller joints, which is one of the topics we're going to basically focus on today. So, among other things, through research on temporary embolics, as well as applications across different type of joints, he's joining us today. And we are really lucky and fortunate to have him today, straight from Japan. And let's just dive in and how all of this began, Dr. Okuno. So, can you take us back to the early days? What inspired you to explore this whole embolization application in musculoskeletal world?
Yes, thank you very much. So in the beginning of the idea that embolizing the inflammatory nerve cells, it started at 2007 or 2008. And at that time, I was an interventional oncologist. Oncologist means treating cancer treatment using a catheter. So I use a catheter. I was interventional radiologist and using catheter and insert it to the artery and inserted to the near the tumor vessels. So tumor cancer tissue requires lots of blood vessels. So they develop the abnormal increased blood vessels. That we call the tumor blood vessels. That is, it's not different from the normal vessels. And during those times, we noticed that inflammatory tissue, chronic inflammatory tissue, also contains lots of abnormal blood vessels, like we call it inflammatory blood vessels. And the first idea is like a cancer treatment, we can reduce the inflammatory intensity by blocking the inflammatory vessels. But as you know, the blood vessels, normal blood vessels, is necessary for the human body. So we cannot stop the blood flow of the normal blood flow. So we invented to infuse a temporary embolic material. Temporary means 1 minute or 2 minutes or 10 minutes or 20 minutes. And it recanalizes in the normal blood vessels. But the ability of recanalization is different between the normal blood vessels and inflammatory blood vessels. So we can selectively reduce the inflammatory vessels by doing the temporary blockade, and we can remain the normal blood flow. So this procedure is totally safe, and so we invented around that, and we did like a basic research using animal model. And after that, 2012, we have started the clinical trial in Japan, Tokyo, and it applied to knee osteoarthritis, so frozen shoulder. And after that, we also applied this to the hand osteoarthritis, like thumb base osteoarthritis or finger joint osteoarthritis.
So this all stemmed, the discovery really was that you were treating cancer and you thought, well, wait a minute, we could actually apply this same theory to osteoarthritis. That's really the moral of the story. That's incredible. And your first cases, were they in the hand or were they in the knee?
First case was shoulder. The
first case was the shoulder.
Yeah, frozen shoulder. The patients who have left mammalian cancer have also developed the frozen shoulder in the left shoulder. So she could not sleep and she could not lay down without pain. And 1 month or 2 months passed from the symptom beginning, and we did the procedure to treat the cancer, and at the same time we have performed angiography, and we know that that is not a metastasis and that is a frozen shoulder. So that is the first case, is the 2000 preliminary one is 2007.
Oh, that's incredible. Well, coming up right here on the Heart of Innovation, we're going to have more with Dr. Okuno. We're going to learn more about hand embolization. We're also going to learn about some new orthopedic methods as well. So stay with us right here on the Heart of Innovation. Don't go away. You don't want to miss a beat.
Okay, we're going to pause for a second before we go into the next segment. I have to reframe everything. We have a new person joining the call.
Oh no! Oh yeah, you do, huh?
Yeah.
But he's not in. He's not in.
Everything. It's just it eats into the frame. I just have to readjust everything here rather than do it on the fly.
I can ask Robert. Robert, do you want to watch it on YouTube?
No, he's already good. It's good.
Are you sure?
Yeah. So I'm almost done.
I can do whatever you want me to do. I can go to YouTube and watch it.
But if you're going to stay for the whole time, just then stay for the whole time so he doesn't have to now rearrange it again.
Well, I actually probably won't be able to stay the whole entire time.
It's okay.
So
it's okay.
That's okay.
You're okay. Yeah, you're okay.
I got to be up at 4 o'clock in the morning for work, so.
Brutal.
Yeah. It's nice though, because I'm done by 12 every day usually.
Yeah.
All right.
And so
segment is going to be 6 minutes.
Okay. Dr. Ginsberg, do you want to bring your pro at this? Do you want to bring us back and bring in Dr. Kadar to maybe talk about first some of the methods of what is currently being done for hand osteoarthritis, and then ask him about his experience as well, what he's
Sure.
new, what's new, and then we'll get back so we can do a little bit back and forth between the two of them. And Dr. Okuno, you can always, and Dr. Kadar, you can chime in at any point.
Yeah,
You can
please
ask
jump in.
questions.
Yep.
You can share insight. It's just a conversation. And I don't care if you step on me.
Assaf, we are looking for tough questions from you actually today.
For me? For a
From
tough
you.
question?
Yeah.
All right, let's go. Bring it on, Misha.
Yeah.
Okay.
All right, who's taking us back?
Is there anything specific you want me to say when I'm taking you back?
Oh,
or
it's
just,
yeah, it's welcome back. Dr. John has the day off, and I'm taking his place as co-host.
Yeah,
We have
you
a
got it.
great show. We're talking about hand embolization.
Okay. You got it. Just give me a holler when it starts.
1 second. All right. 3, 2, 1, go.
Welcome back. And here we are today, and we have wonderful guests discussing hand osteoarthritis and new innovative treatment option, musculoskeletal embolization, and specifically hand embolization by one and only the pioneer, and as Kym correctly coined it, the godfather of musculoskeletal embolization, Dr. Okuno. And we're also very lucky and fortunate that Dr. Kadar agreed to join us today. He is a specialist in hand osteoarthritis. He's a hand surgeon, an orthopedic surgeon back from Canada. And he runs a lab that explores new innovative devices as they apply for hand osteoarthritis and base of thumb arthritis. So, Assaf, maybe like we had earlier today, you kind of started mentioning the demographics and some of the background of hand osteoarthritis. So if you can just introduce us to the sort of conservative route and conventional route of treating hand osteoarthritis as a hand surgeon, how you get the patients, at what stages, how you sort of address them, and how do you escalate therapy?
Yeah, so hand osteoarthritis at the base of it is a disease of cartilage. Like any osteoarthritis, basically two bones rubbing together, and you have bone-on-bone contact, which is, we think, a pain generator, which causes pain. We have it in the knee, we have it in the hip, and it's very common to see in the thumb, as I mentioned before. Over 30% of postmenopausal women will experience some form of hand osteoarthritis, so it's a very common problem, and it's a problem without a solution. So, and we get these patients at definitely various stage of the disease. So it can be a very mild disease where you won't see anything on X-ray, or it can be a progressive disease. And the treatment is, tailored to the patient. We have a huge variety of treatment options. We just learned about the embolization today. I at least learned about it today. So, when you have so many treatment options, that means that you don't have one good option, as you know. We don't have 500 ways to replace a hip joint because there's one surgery that works. So the thumb is not the case. So as you said, the treatment will be tailored to the patient. So for instance, usually patients in the very early stage will be treated with pain medications or anti-inflammatory drugs as simple as Advil. Next step of that treatment ladder usually would be hand therapy, and the hand therapists are, our colleagues, and they do wonders. There's a lot of innovation in that field as well. It's a huge, huge field. 3D printed braces are a big thing now, and technology is evolving there. So as simple as taking a camera from your phone, scanning your hand, and then the company will sort of like print out your 3D printed brace. And studies have shown some improvement over traditional braces that you buy in one of the Walgreens or something like that.
So the
And then
whole
the next
idea there is just to keep it immobile. So
Exactly.
I have, you probably can't see, but right in
I
here
see.
you can see.
I see.
You see, well, do something. It's not painful though, but with the brace, is it just that, which is good. Sometimes it feels a little stiff, but is it just that it stabilizes it so that you're not continuing to have bone on bone and creating an even bigger bump there and even, pain at some point?
It's I think the principle is immobilization mostly, and reducing the load between the two bones, which is the base, this bone, the metacarpal bone, and the trapezium, which is where the arthritis happens. If we talk about the next step, injections, we're looking at injection, usually steroid injections into the joint. We can do it with or without imaging. Now I would say I would recommend doing it with imaging for almost everybody because it's more accurate. And then the next step of that ladder will be surgical treatment. And there's certainly a lot of innovation there. I think there's going to be a huge change in the way we treat this problem in America and Canada in the next 2 or 3 years. Things have begun in Europe and have been progressing there for the last 10 years, which is basically replacing that joint. So if you believe it or not, right now we're not replacing that joint, which is arthritic. We're just removing part of it, which works. But I think replacing the joint, is the way of the future here. So that surgery has had very bad reputation in the past, but now new technology really improved the outcomes. So it's going to be a huge shift in the way we treat that problem.
And coming up right here on the Heart of Innovation, we're going to find out who is the perfect candidate for this. Just how bad does the osteoarthritis have to be before a patient actually qualifies for a joint replacement in their thumb? Just as if you were going to get a knee replacement for knee osteoarthritis. And we're going to ask Dr. Okuno whether the hand embolization, the osteoarthritis embolization in the thumb, maybe in particular, may delay these types of surgical procedures. So stay with us right here on the Heart of Innovation. Don't go away.
Roger that.
Thank you.
Assaf,
Ready to
great
take us
introduction.
back, Dr. G?
What was it good, Misha?
Yeah, I
Okay.
think it was fantastic. Yeah, and
Yeah.
also, it's very exciting from your standpoint of view as well, not just from our standpoint of view. Clearly, there's a lot of innovation in the field, and that's definitely groundbreaking. If they eventually, some people will be candidate for a whole joint replacement, that's exciting.
Yeah. That's pretty cool because we'll have to get in, like, who are the doctors? I wouldn't want to be a guinea pig, but let's get into.
So I think Kym, I think the thing is, it's all on the spectrum, right? And there's lots of people who, obviously this is kind of the end stage thing. There are people who get knee replacement or get hip replacement. Presumably, I'm speaking as someone who has no knowledge whatsoever about those joint replacements in the hand, but Assaf, correct me if I'm wrong, but here, the spectrum is also probably going to be similar.
What do you mean, spectrum of patients?
In terms of, like we, when we look at the knee replacement, usually it's, severe bone on bone when people are ready for.
I mean, usually we're looking at patients with end stage arthritis, where I believe that embolization, I don't know, embolization might be more early stage. I don't know, but
well, that's going to be the
what we're
question.
gonna have to.
I wonder if the embolization is basically fitting in where the, before just the stage, just before surgery. So where
injections
we do
or
maybe the injections, after that immobilization, then surgery, maybe.
Let's get into all of that. And this next segment, you want to take us on back, Dr. G?
Sure.
Okay.
Let me know when. Give me
This is 8 minutes. 3,
segment
2, 1, go.
Okay, welcome back. And here we have Kym, Dr. Assaf Kadar, and Dr. Yuji Okuno, and myself talking about hand osteoarthritis, a new innovative treatment, both in the conventional world of hand osteoarthritis with very exciting developments in the field that are about to happen in the next year or two. And we have Dr. Okuno with Okuno Method, straight from Japan, Tokyo, and who is talking to us about specifically today embolization for hand osteoarthritis. So Dr. Kadar did a great job introducing us to the background and demographics of hand osteoarthritis and how it's treated today. And we were just getting into this conversation about the spectrum of disease and where different treatments come in. And I think this was where kind of Kym sort of said, let's now review who are good candidates for embolization for hand osteoarthritis. What is the evidence up to date to the effectiveness of this technique? And what do you think, and that is a question both for Dr. Okuno as well as Dr. Kadar, would convince Dr. Kadar that this has significant potential where he would potentially refer a patient?
Yeah, Dr. Okuno, I think we'll start with you because I mean, I'm just wondering in terms of the surgical, the replacement of the joint would come way far down. It has to say, you know, it's waking me up at night. I would imagine for you, that would be what you're doing with hand embolization would come first and more early on. Is there, you have the steroid injection, or maybe you have the PT, maybe medication, PT, then steroid injections, then the embolization?
No, we can do more audio. If you, more audio, and we recommend to do embolization, and even though the patient who have never received the steroid injection, because as we, every physician can agree that corticosteroid is damaging the joint as a cartilage. So we don't want to do that. And if you had that embolization procedure, you must feel that that is a very invasive. And actually it was. In the early of my career, we have performed the puncture using a needle to the femoral artery, groin, and insert the catheter, long catheter, to the hand. And that was very long time. It takes a long time, and using an expensive device. But now we have invented the new technique that is the Okuno method, and we using ultrasound and observing the radial artery. The one of the most famous, and we can use to pump the and we just use a 27 gauge needle, that is very small needle, to directly puncture this point and inject the temporary embolic material to this peripheral area, and we can treat some base and also treat this finger joint at the same time. But the important thing is takes 1 minute, and the needle size is very small, and it's minimally invasive, and invasion is smaller compared to the direct injection to this by using steroid injection. So we can. So we can do that without a severe, without a big invasion, and sorry, this is a minimally invasive treatment, and we can do more earlier compared to the steroid injection, and we believe that. As you know, the inflammation drives the degenerative change. So the early stage of the sun-based inflammation, the patient feels pain and in the daily life, and the stiffness or the symptoms, earlier symptoms, the patients already have the inflammatory vessels, but still the cartilage is remaining. That is a phase, is a good phase to start. If the patients have end-stage osteoarthritis and the cartilage totally lost, and the bone marrow is disruptive, in those cases, we cannot contribute a lot. So our embolization procedure is fit to the early stage and middle stage, moderate stage, but end stage we cannot do we cannot contribute a lot. That is a basic concept.
Do you have to go in? How invasive is the diagnostic? Can you tell what stage they're in just by an X-ray and or ultrasound?
Yes, yes.
Yeah.
We have a grading of Eton grading, that is X-ray grading of the degenerative change, and we also can do the ultrasound diagnosis, and we can see the thickness of synovial tissue, synovial membrane, and we can see the increased color Doppler signal, or that is also useful to diagnose.
Can you do all
part
the
of your
joints in the
exam?
fingers?
Go
Can
ahead,
you do
Kym.
all of the fingers
Yes, we can do the other
in one
fingers.
procedure?
Yeah, one procedure. Sometimes patients have not only thumb base but also the finger, the second finger or fifth finger. So we puncture the radial artery and the ulnar artery, and we can treat the both.
So Kym, it's non-selective, right? Like they basically access radial artery and infuse the temporary embolic, and it affects the entire hand, right? It affects the first metacarpal joint and affects all the other joints, and it's temporary, right? So and it preferentially goes to the inflamed tissues, because those are the more hypervascular tissues. And Dr. Okuno can tell us about the method, how he sort of came up with the embolic, if specifically, and ultimately, you know, I'm kind of jumping the gun, but what's the evidence today, where we are today in terms of evidence behind osteoarthritis? Because I think that's what Dr. Kadar is interested, because he's clearly excited for his patients.
Yeah, so our results showing that for the early stage and the moderate stage, like Eton grade, like from 1 to 3, the patients have a clinical success rate was around 80 or 85% for the two times injection, like 1 time and 2 time, and 2 years later, the clinical success keep maintain for the 85%. So I think it's a relatively good results, and the most of the patients have already received the corticosteroid injection in that cohort. So I think we can apply this technique in the early stage and also the moderate middle stage.
And coming up right here on the Heart of Innovation, we'll have more with Dr. Okuno and Dr. Kadar. We'll get Dr. Kadar's reaction to hand embolization coming up next right here on the Heart of Innovation. Don't go away.
Perfect.
Excellent.
I think it's very interesting. I think the ultrasound is something that we're looking at in our lab now, and we're looking at, you know, the vascularity of these tissues, and what we see is that we use actually a very interesting technique. It's called a 3D ultrasound. It's also going to be something new that's going to come out of our lab, and that company is going to be, I think, a big thing. It's called Novasonics. Never mind, we're not going to mention any names. But what we found is that for late stage osteoarthritis, there is no blood flow. It's basically the joint is worn out and there is no blood flow to it. So it's like desert, no blood flow. So it's very interesting.
So what I would really like, Misha, could you start generating the conversation between Dr. Kadar and Dr. Kadar? If you have questions for Dr. Okuno, it'd be really cool to hear the dynamic for someone that, you know, is thinking like you do surgical procedures, right? Like, what would you be asking him generally? And also, Misha, is this something that you do or you want to be doing this?
Well, I think I'm one of those people who don't jump into procedures, immediately. I'm waiting for a little bit more evidence. I think that we have a lot of evidence now for knee osteoarthritis, and I'm waiting for the results, and obviously quite amazed by the fact that it's becoming.
You can now help create the evidence.
Well,
you can now help create the evidence. You can practice on me.
Exploring, right? Like,
you can practice on me.
Yeah,
I'll let you.
Well, it seems like it's much more straightforward than any other of the embolization procedures we perform. You see, it doesn't require fluoroscopy imaging. It doesn't require any selective catheters. it's really mind-blowing, and that's thanks to Dr. Okuno and his innovative approach of how, that's something that probably Dr. Assaf Kadar can do in his office.
Yeah, because we
Oh yeah,
wanna,
I mean, you just go ahead, Kym. Sorry.
well, because I want to get this. This is great. I want to get this actually into the show. But also we should get to, before we go, like, I don't know how long this lasts. With the temporary fix, 1 year, 2 year. If we have any data.
Kym, he mentioned
Oh,
that
did I miss it?
we did his cohort. I'm not sure how many patients it included. I'm waiting for Dr. Kadar to challenge and ask some tough questions in regards to the evidence base behind it. But ultimately, if I heard correctly, Dr. Okuno, you mentioned 84% clinical success that is maintained at 2 years.
Or at 2 years.
Based on his patient registry. Is that correct?
Awesome.
Yeah. For the early stage, clinical success rate is very high. Yeah.
Awesome. Okay, Dr. Ginsberg, I'll let you start the fun conversation, then I can be a fly on the wall too.
All right, welcome back. So we just finished this amazing conversation about when to start treating with embolization, and we heard that Dr. Okuno recommends treating patients with hand osteoarthritis at an early or moderate stage. We heard about some of the high clinical success rate, especially for the early stage, and how simple the technique is. How simple, straightforward, requires ultrasound, can be probably performed in someone's office or a clinic, and just 27 gauge needle through the radial artery, no selection. What is it? 5 minutes and done, Dr. Okuno?
Yeah, 1 to 2 minutes. Yeah.
1 to 2 minutes and done.
Yeah,
so mind blowing, right, Kym? Dr. Kadar.
Wow.
Yep. So
please challenge us.
No,
what would it take to get
first
your business?
First of all, I will definitely want to try and see the evidence. I did have some questions. I would say about 10 years ago, and probably still some places will teach that to the medical students. They said you can't inject anything near the fingers or near any end organs like the nose or the ear. You can't inject adrenaline because the blood vessels will constrict and then will go into necrosis. So how can you, so I'm going to challenge you, how can you justify injecting a material that you know that clogs the blood vessels into the tip of the fingers and maybe, or the area, and maybe ask you if you saw any complications like finger necrosis or something like that with your technique?
Yeah, thank you, Dr. Assaf. So first we heard about embolization of fingertips. So all physicians will feel that such a risk of the fingertip necrosis or other. That is, of course, there is a reasonable concern, but please notice that our agent, temporary embolic agent, is recanalized very fast, so within 10 minutes or 20 minutes turn to normal color, so it's totally safe. So in Japan, we have performed more than 5,000 cases per year for the finger osteoarthritis, hand-based and finger osteoarthritis, and no one has developed necrosis or.
Dr. Okuno, 5,000. I'm just making 5,000. You said
5,000 per year. Yeah.
Wow.
Yeah. So it's very safe. We can say that it's very safe, and but still it's effective. There is one paper and published last year that they for doing the animal study that they compare the recanalization process between the normal blood vessels and inflammatory blood vessels, and after doing the temporary blockage, and the normal blood vessels decanalize within 90 minutes, almost at 10 to 20 minutes. But the inflammatory vessels gradually decrease in 90 minutes. So that is the difference, and we can use this difference to do the procedure without a risk of necrosis.
So you mentioned that you did 5,000 cases in Japan. Did that affect the rates of, let's say, steroid injections or any other treatment? Did you see any sort of shift in the way you treat osteoarthritis of the thumb?
Yeah.
In
so
general,
now
less. Yep.
it's not general, but it's still new. But we have now in Japan we have 150 clinics, orthopedic clinics, who have already introduced this technique because not only the interventional radiologist, but also the physician who can use the ultrasound can also do this technique because this technique is very simple. So we feel that in this area, the gradually changing the treatment algorithm.
The paradigm. Mm-hmm.
Yeah. Don't get me wrong. I'll be happy to stop injecting steroids into the joint. I think it's bad for the joint. Find anything that is very minimally invasive, it's better to use it for sure. Certainly, we were interested in where it will fit into the treatment algorithm. But did you ever compare it to, let's say, if you inject anything else into the?
Yes, that is.
Did you do like a clinical trial in comparing it to saline as an example?
Yeah, thanks so much. So that is one kind of evidence we have to now required, and now we are doing the sham control trial, and but we have to choose because we have lots of indications. Now we start with the tendinopathy. Tendinopathy means that like tennis elbow or Achilles tendinopathy. We are now doing that the clinical trial between the sham and the control group. And the other thing is that in US for the knee osteoarthritis, we do the physicians in UCLA who is now doing the randomized control trial between the steroid injection and embolization treatment. That is, yeah. But I totally agree that we need to do that the comparative study. That is the most important. And I think the two things is very important to change the paradigm. Because most physicians now doing the steroid injection, but the important things, one is a safety profile, invasive, minimally invasive, 27 gauge needle, and very safe, no complication for the 5,000 per year. That is important. The other thing is the price of the medical device. We injecting the very cheap, using a small needle, a small syringe, and embolic material is now using imipenem. Imipenem is very cheap, so we can use a $1 or $2. Is a very cheap. That is also important things to become the primary treatment option. We want to change the paradigm or treatment algorithm after the conservative treatment.
And I'm curious in terms of PRP, stem cells, that's what I ended up having so far, actually in both hands, that helped to alleviate. So now I have full mobility back and I don't have any pain. I have the inflammation in there. I don't know if that'll ever go away, but at least right now I don't have any pain. It's just unsightly. What do you think about PRP and stem cells as, compared to this hand embolization?
I think the ability to reduce the inflammation is superior in the embolization compared to the PRP or stem cell injection. I believe the mechanism that work in the PRP or stem cell is also the reduction of inflammation, not regenerative, but reduction of inflammation. So I think I know that PRP or stem cell works in some cases, but it's not reliable. It's not reliable.
No, I would agree, and there is no good evidence to support the use of PRP over steroids, for instance, or hyaluronic acid. So theoretically, it's better, but we don't have the clinical evidence yet for that.
And insurance doesn't cover it, so you got to go with
Industry
what's
is a big
also
thing there for
cost-effective.
sure, Kim.
Well, coming up next right here on the Heart of Innovation, we'll get final thoughts from both Dr. Kadar as well as Dr. Okuno. So stay with us right here on KDOW. Don't go away.
Right on.
That was absolutely fabulous.
It's amazing.
Oh my goodness.
It's
Dr.
all-
Kadar,
and
Dr. Okuno, seriously.
I wish I could
nice.
get Dr. Ginsberg's giant smile as he's hearing all of the data come out in the frame. He's just cheesing the whole time.
I mean, it's mind blowing. You know, like you were talking about all those other embolizations that you perform in the United States, and this is just like a true paradigm change, just because of the ease of the procedure. You know, the patient experience, and you know how safe it is. The magnitude.
So it's just a local? It's literally
it's-
just a local?
Yeah, I mean, it's essentially like it's easier than drawing blood.
Yeah, I mean, it sounds very easy, and you inject an imipenem, it's pretty amazing. It's a cheap drug. You're gonna have a lot of industry fighting you for this, Dr. Okuno. I'm sure you already feel it blowing down your neck.
Yeah, they're going to want to put it in a
Huge,
box.
huge.
They're going
Huge. I
Kim,
won't
it's a
ask you how
revela-
much the
it-
PRP cost you, Kim. So, but I know,
Yeah.
I have an idea.
So
Yeah,
honestly,
it was
for the
expensive.
American sort of listener, I think, and for physicians in general, you know, this is mind blowing. What Dr. Okuno is doing is essentially a very disruptive to the whole field, right? And not just from a standpoint of view of efficacy, but accessibility to the procedure, right? Like the ease of adoption, right? Like, and this is probably Dr. Kadar can sort of talk about this. This is not, you know, this is not sending someone for some kind of high risk or, you know, mild to moderate risk procedure. This is 1 to 2 minutes procedure in the office. This is mind blowing.
Yeah. Would love for you to actually start off the final segment with that and get the final thoughts from Dr. Kadar and Dr. Okuno on just the game changing and kind of what's next. But is anyone in the US doing this? Or
Well,
should
we
I
had
ask,
a-
should people be doing this if they don't know Dr. Okuno's method? Because it is,
Well-
as Dr. Kadar says, it could be risky if you don't
Well,
use
Dr. Okuno gives amazing talks, and I know that many people attend those both lectures as well as conferences. Dr. Okuno, feel free to throw a plug in for the conference coming up in Japan and when it's coming, so our listeners can
Yeah,
find
make
out
sure
about.
to put it, make sure that when we do in the last segment, we only have 4 minutes, but make sure it's in there so that we can do a plug. But I'm thinking, what do you think, Josh? We need to send Dr. Kadar and Dr. Ginsberg back to Japan on a, you know, they need to go and scrub
See,
in and learn
I
how
like
to
where
do
you're
it.
going with this, but I also
Yeah.
just kind of want to kidnap Dr. Okuno. And then we just keep him
Bring
here,
him.
right?
And
You know
just
what I
bring
mean?
him to the US.
We'll just ruin him with terrible food.
Terrible processed food versus beautiful fish that you guys have there. I love Japan. Maybe I need to go too. Maybe my dad and I just need to hop on a plane and go see Dr. Okuno, have some great meals and go when the cherry blossoms are blooming and have a great trip.
See, now
That's
you're
what I'm thinking. Okay, I'm in. Okay, 4 minutes.
All right, so 4 minutes. When you see the 30-second mark come up,
It's
just in your
serious.
head, imagine that music starts to play.
Yeah.
Okay? And who's taking me back?
Here, let me just show you. Can I just put in my dad's hands? Hold on. So here, can you pull in? He just got a massage, so he's in his massage robe. He wants to see your knuckles. With put your fingers out.
Oh yeah,
Do you
he
see all
has
the-
osteoarthritis for sure. PAP osteoarthritis.
Yeah, osteoarthritis. Yeah.
So you have two people that are going to treat you here.
Right.
See you in a second. I
Come,
got
come to Canada. Canada is closer.
Yeah,
So now I'm
well,
in the States. Now I'm in the States. Okay, so.
Dr.
Okay.
Ginsberg, are you taking us back?
Sure. Is this time good time right now?
Well, we're about to count it down.
Okay. Welcome back. We just heard some unbelievable information from Dr. Okuno about how easy it is to perform hand osteoarthritis musculoskeletal embolization. Takes about 1 to 2 minutes. It's a 27 gauge needle, in and out. And Dr. Kadar is mind blown. He's interested in exploring it possibly for his own patients. Definitely looking into the evidence, and had really great questions to ask. And what are the next steps in terms of evidence-based approach to hand osteoarthritis and treatment options for the patients. In the break, we got to see more advanced osteoarthritis of Kym's father. Very impressive indeed. And he's heading after the show, I think, already to Dr. Kadar, because he's already too late in the game. According to Dr. Kadar, that's a desert. That's a desert hand. You know, in peripheral vascular disease, we call about desert foot, and that's when there's a really bad vascular disease affecting really the foot and below the ankle. Well, here we have a hand osteoarthritis desert hand, new term just coined by Dr. Kadar. So we want to learn about how other physicians can learn about the treatment of hand osteoarthritis from a musculoskeletal embolization, what's up and coming from Dr. Kadar, and the more advanced desert hand osteoarthritis with possible joint replacements. So let's start with Dr. Okuno. Maybe you can tell us about how other physicians and how learn. You mentioned you have 150 clinics in Japan performing embolizations, and you mentioned that for just hand osteoarthritis alone, you perform about 5,000 embolizations per year. Is that correct?
Yes. So we are now preparing the international congress that is focused on this technique, not only the finger or thumb base, but also knee, hip joint, and other front and shoulder. So that is the meeting. The name Benti meeting is held in November this year. November 7 and 8 in Tokyo. That is the first time to we organize, and many physicians will come who are keen, who are interested in this technique. So if you and not only that situation, but also we are now doing the workshop like to do the ultrasound guided technique. That is the easy one.
And Kadar, Dr. Kadar, are you heading over there to Japan? Are you going to scrub in and work alongside Dr. Okuno so you can come back and treat my dad and me?
Sure. I mean, again, I'm giving talks about innovation. That's my most common talk, innovation in hand osteoarthritis. Certainly, I'll be happy to come to Japan and talk about the orthopedic approach to it and the joint replacement. For sure, it's very interesting. You know, I'm like Misha, like Dr. Ginsberg, I'm a man of evidence. I need to see the evidence. It sounds like it's going to be there very soon. So once it's there, I'm definitely going to be a first adopter in
Well,
Canada.
I think that you and Misha should be a part of creating the evidence. I think you guys should be a part of the pioneering crew here in Canada and the US.
Is November a good month to visit Japan?
Yes. Early November is still good temperature, and the food is very nice. Yeah.
Okay.
The food is really nice. Well, thank you so much, Dr. Okuno, Dr. Kadar, for being here, and great job, Dr. Ginsberg, pinch hitting for Dr. John as our guest co-host. Thanks so much, everyone, for joining us. Make sure you subscribe to our channel, youtube.com/the way to my heart for more great content like this.
Thank you.